I'm Ashley Casey, independent candidate for Congress. On April Fool's Day 1992, I got a call on my Columbia University dorm phone asking me to come downtown and ask Bill Clinton some questions on the Phil Donahue Show. Well, I thought it was an April Fool's joke, but it turned out to be true. What you're about to see is the tape that my mother actually managed to save all these years. I think it was the only thing she ever learned to record on the VCR.
All right, Governor Clinton, Medicare reimbursements for primary care physicians were essentially frozen in 1984. Today, many primary care physicians are considering not taking any new elderly Medicare patients because the reimbursement does not even cover their overhead. If the doctors won't take the patients, like people like John Kingsley, how do you prepare caring for this segment of the population?
You have to have a national health care plan. And you have to... Nope. And you've got to have a uniform reimbursement system in every state. You can't have a different reimbursement state for Medicaid, Medicare, and private pay. And if we had a national system like every other advanced country in the world, you'd have a uniform reimbursement, and doctors would take Medicare patients and people that are now on Medicaid. That's what I propose to do. We are spending, as almost every doctor I know admits, that we're spending as much money as we need to spend, but we're spending it in the wrong places. It's going to insurance companies, healthcare bureaucracies, the government regulations. If we reorganize this system and had a national system to provide affordable health care to all, then you could afford to have uniform reimbursement for people, whether they're covered in the workplace or by the government, and that's what I propose to do.
Not necessarily good news, but I know you have more questions.
In May, I hope to be representing you in Washington. And I think Bill Clinton may be up there too. We can meet up on TV and talk about health care again.